Good evening from India. I hope I am audible now and you are able to watch the topic on introduction of Ayurveda. Please write in the chat box or unmute yourself. And I will request if it is comfortable to all, you can switch on your video also for just few seconds. So I will mark the attendance. Then you can switch off. There is no issue. If it is possible, if you are comfortable, please um, switch on your videos as well for few seconds only, so I will mark the attendance. Thank you. 1 minute, I'm just okay. Thank you. If you're comfortable, you can mark it, you can make it off also if you're comfortable, or you can keep it right there. Okay, so this is the very first topic when we start the training. Almost any training we have three Ayush approved trainings: basic level fundamentals, advanced level fundamental, as well as the diet and nutrition. So this is the first topic that we discussed on in every training. So this is about the Ayurveda. So today, what we are going to discuss, I will quickly share with you. We will discuss the definition. What does Ayurveda mean? Then, in a very short explanation, we will discuss origin of Ayurveda, how it was originated, and how it progressed. Then, unique aspects to Ayurveda, how Ayurveda is different from other medical fields. Next, aim of Ayurveda, why it was written, why it was presented to the world, and eight branches of Ayurveda. Today we see a lot of specialization in Ayurveda, but Ayurveda has been divided into eight branches that we will discuss. Then we will discuss about the mind, body, and soul integration, soul concepts, and if time permits, few more topics like the soul and the five sheaths around the soul, Panchakosh. These are the topics for today, but if you are interactive, if we are interacting more, if you want more clarification, we may not be able to finish the whole chapter, but as much as we will do, I will try. So we have 1 hour. We will be active till post 8, 8:10, 8:15, because we have another class at 8:30. So I hope it is clear to you, and now we will start with the topic. Yes. If any one of you have any query, you can unmute in between the class. You can write down in the chat box also. So everybody will be benefited by your questions. Don't hesitate to ask the questions. So today we are discussing about Ayurveda. We are entering into the field of Ayurveda. It is the oldest branch of medicine. It's the oldest practice of medicine in the over the globe. So it is the Indian system of medicine, Ayurveda. So Ayurveda has been written initially in Sanskrit language, Devanagari language. In Sanskrit language, Ayurveda, it is made up. Ayurveda is made up of two words actually, Ayu and Veda. And when we combine together, we pronounce it as Ayurveda. So it is having two components, Ayu and Veda. Ayu stands for the life, and Veda stands for the knowledge or the science. So, science of life, the knowledge of life is Ayurveda. Now, what is more important is the definition of Ayu. If any one of you can share what do you mean by Ayu without looking at the notes, or what comes to your mind, share with me. What do you mean by life? When we say a person is live, any one of you can unmute, any one of you can type here in the chat box. What do you think is life, or what do you feel you can define life as? I hope I am audible, and the question is clear. How do you define life? When do you say people are live? Okay, there is one, Italia is sharing the way the people live, think, eat. Okay, the way people if we are living means we are thinking, we are eating, so we are live. Okay, this is one definition. Good. And others people say we are live till we are breathing. So breathing is also one of the definition of life. Life means being active also. Yes, the dead people are inactive, live people are active. Breathing is also one of the terms on which we can define a person live or dead, right? But now let us see what Ayurveda says. If anybody wants to share anything else, you are most welcome. If any other idea, if any other views are there, you can share. Any other idea, any other view? Okay, now let us see what Ayurveda says. So, okay. So Ayurveda is, if we talk about the history of Ayurveda, it's around 5,000-year-old Vedas. That time, uh, these books were written on the leaves, uh, Bhurj, Bhurjpatra or Bhojpatra, a special leaf that uh, we were using, or the bark of the tree we were using to write down. So 5,000 year old. So according to Ayurveda, what is life? What is Ayu? Ayurveda defines Ayu as the Samayog, or the correct combination. Samayog, the correct combination of the body, which is destructible, and we are perishable, we are mortal, and our senses, the five senses we have, the sense organs, the mind, the think tank, and the reincarnating soul, the indestructible soul. They all, if have a very correct combination, then we call it as a whole life, or the Ayu. So only the physical body is not about the life. It is the combination of the physical body, the sense organs, the mind, and the soul. If they are working together in harmony, then we call it the life. So Ayurveda is considered as the most sacred science of life, beneficial to humans both in this world and the world beyond. So it is having a relation with the spirituality as well. So being an Indian philosophical uh, art and science, Ayurveda is believes in the philosophy as well. So it's not like the Western science. It's not only based upon the research and datas and clinical trials. It has a lot more to do with the psychology and the philosophy of Ayurveda, spirituality as well. So this is about the Ayurveda. Ayu means the life, and life, which is the combination of body, sense, mind, and soul. And the Veda is derived from the Sanskrit word vid, which means to know something, to gather some knowledge. So it is the science of Ayurveda. Okay. The Sanskrit quotation about the Ayu is Sharir Indriya Sattva Atma Sanyogo Dhari Jeevitam Nityagash Anubandhascha Ayur Uchyate. It is written in the black arrow here. It is a complete quotation. Sharir Indriya Sattva Atma Sanyogo Dhari Jeevitam Nityagash Anubandhascha Ayur Iti Uchyate. Sharir means the body, Indriya means the senses, Sattva means the mind, Atma means the soul. So it is the definition of life. After doing the definition, understanding what is Ayurveda, we will understand about the origin of Ayurveda. So when we discuss the origin of Ayurveda, so Ayurveda is the most ancient. Vedas are the most ancient depository of human knowledge. Human knowledge, as per Indian belief, that they are derived from the Vedas. So Vedas are actually 5,000 old depository of human knowledge, and all the subjects of art and science, mainly linked to the Indian science and art, they have their original source in four Vedas: Rig Veda, Yajur Veda, Sam Veda, and Atharva Veda. They are the four holy books originally written in the Sanskrit language but now translated into English, Hindi, Italian, Russian, Spanish, French, most of the languages in the world, they have translated these books: Rig Veda, Yajur Veda, Sam Veda, Atharva Veda. And in the ancient time, people were transferring their knowledge orally. Like the disciple was or student was going to the teacher, teacher was teaching to them, and he was delivering his knowledge to the student, and that student again became the teacher. He transferred the knowledge to other students. That was the main way of transferring the knowledge. As the time passed, they started writing it down, and when these Vedas were written in the books, uh, then came the composition of other samhita, or compilation of all these knowledge, which is available at present time also. So it is believed that Lord Brahma, who created the all the human beings, Lord Brahma, he captured the knowledge from the four directions and created the Vedas. And initially, they were transferred orally to the disciples. Now, the fundamental principles like human anatomy. Anatomy is the structure of human body. Like we have bones. How many bones are there? How many muscles are there? How many joints are there? This is the knowledge about the human anatomy. And physiology. Physiology is the functioning of the human body. So how our digestive tract is working, how we are digesting the food, how our heart is pumping the blood to the whole of the body, how circulation is going on, how we excrete the urine, how we are thinking. This all functioning part is the human physiology. Pathology is how we get sick and what happens in the disease, like fever, what happens in diarrhea, what happens in the body, in diabetes, in hypertension. That is the pathology. And pharmacology, how this herb is working in the body, how this ashwagandha is working in your body, how turmeric is working in your body, and how the cumin is working in the body. This knowledge is the pharmacology. And surgery are available in Vedas. So, what we call the researched uh, part of the medical science was also available in Indian philosophy, in Ayurveda, 5,000 years back as well. But they were written in their own language, they were having their own understanding, they were gathering the knowledge through spiritual means, through exploring directly, also through examination, by discussions. They were gathering this much of knowledge and they compiled in the form of Vedas. So Veda have all the knowledge about human anatomy, physiology, pathology, pharmacology, surgery. Everything is available in Veda. Apart from these, many other Indian philosophical science and arts like Vastu, like the art of this politics, like how to run a very big politics, how to win over the enemies. Every knowledge about Ayurveda, about the music, Indian classical music, everything is available in the Vedas. So they are the rich source of Indian philosophy, Indian art, Indian science. Atharva Veda, out of these Vedas, I told there are Rig Veda, Yajur Veda, Sam Veda, Atharva Veda. The most ancient is the Rig Veda, and the last one is the Atharva Veda. In Rig Veda, Yajurveda, Samveda, initial three Vedas, there are few references about Ayurveda, about life, about what is the aim of Ayurveda, about Vata, Pitta, Kapha, about some herbs. But the last one, Atharva Veda, it has much more description about Ayurveda. It has descriptions about the uh, uh, human functioning, the physiology. It has information about a lot of diseases, about their cure, about surgery as well. So it has much more description about Ayurveda. So Ayurveda is considered as the Upaveda or the branch of Atharvaveda. So most of the knowledge from Atharvaveda has been transferred as Ayurveda. It is the branch of Atharvaveda. So in this era, in this time, there was no demarcation like the medicine or the surgery or the pediatrics or gynecology or orthopedics or eyes, ENT disease. No, everybody was everybody who was having knowledge of Ayurveda, he was practicing Ayurveda in his or her way. Right? But what happened around 1500 before Christ, Ayurveda was delineated into the two distinct schools. There were two branches, two thoughts of school were formed at that time. So one school was led by the Atreya. He was the main mentor of that school. He was the leader of that school. That was the school of physicians. They were mainly giving the medicines. They were diagnosing the problem. They were analyzing why this problem happened and what is happening in the body. And they were using the herbs. They were using the home remedies. They were using some other tricks, but no surgery. They were the schools of physicians. And second mentor was Dhanvantri, who was the leader of the mentor of schools of surgeons. These people, they were more doing some kind of surgeries, like they were able to heal the wounds. If somebody was injured, they were able to take care of that person. They were able to heal the broken bones. They were able to stop the bleeding. They were able to use the animals like leeches, medicinal leeches, and Dhanvantri school or the school of surgeons. They were doing the plastic surgery as well at that time. As Sushruta is considered as the father of modern plastic surgery. Even the plastic surgeons of today, they consider Ayurveda, Sushruta, the Ayurveda surgeon, as the father of modern plastic surgery. He was the first person who tried to, who successfully performed the rhinoplasty, or he reconstructed the nose of a person whose nose was cut, he was injured. He reconstructed the nose at that time without any anesthesia, without any antibiotics, without any other sophisticated instruments. They were able to reconstruct the nose. So this made Ayurveda a more systematically classified medical science. Thereafter, after that, we were able to discriminate these people are the physicians and these people are the surgeons. But as the time passed, there were some more specialization that we will study in the next part of the this chapter. So these two schools of thought led to writing of two major books on Ayurveda. So at present we have some major books which are very important, which every Ayurveda doctor reads. They are the Charak Samhita and Sushruta Samhita. Samhita means compilation in very easy form that one can understand. So from Vedas, it is very difficult to extract the knowledge. They are scattered, and they are not in classified correctly. But in samhitas you will find a separate chapter on fever, separate chapter on rejuvenation, separate chapter about the diabetes, separate chapter about the tuberculosis. They are all have been mentioned in the samhita very systematically. So Charak Samhita is the main book, followed by the school of physicians. Those who want to practice as a physician, they are following more the Charak Samhita. And Sushrut Samhita, this book has been followed by the people who are the members of schools of surgeons, those who are performing the bloodletting, those who are performing the bone setting, those who are able to heal the wounds, who are able to use the instruments for any kind of surgery, they are following the Sushruta Samhita. So they are in Sanskrit language, Hindi language, English, and many internationally international languages that they have been translated. You can find these books in almost many languages. So far we have discussed the definition of Ayurveda, the meaning of Ayu, life, definition of life, and the meaning of Veda, science or knowledge. Then we discussed about the origin, how Vedas were created by Lord Brahma, and uh, what are the four Vedas. Atharvaveda has more description about the Ayurveda, and there were two schools of thought, two schools of one school of physician, other school of the surgeons, and then the books, major books on Ayurveda, Charak Samhita and Sushruta Samhita. So far, if there is any doubt, if there is any question, feel free to ask. If anybody has any question, write in the chat box or unmute yourself. Otherwise, we will continue with the origin of Ayurveda. Any question about that? So will we discuss something from Charak Samhita? Yes, most of the many topics of Charak Samhita will be discussed, like when we discuss the fundamentals in people who are doing basic level or advanced level or even diet nutrition, we discuss the fundamentals, like what are the five elements: the space, air, fire, water, earth. What are the three doshas, vata, pitta, kapha? What is the prakriti? What is the agni or digestive fire? The all topics are from the Charak Samhita only. And in fact, what you will study in my notes, I have compiled from Charak Samhita, Sushruta Samhita, and one more book, Ashtanga Sangrah. So these three books have been used to compile these notes, but still you can also have access to all available Charak Samhita. I will share. Previously, I had shared in my groups, WhatsApp groups, the link to um, freely available, downloadable Charak Samhita, Sushruta Samhita. They are available in English language or Hindi language. You can download from there. You can start reading also. If there is any question about any topic that we are discussing, if it is relevant, I will be addressing it in the class also. So these topics are the we will study in the coming chapters. They are from Charak Samhita, Sushruta Samhita, Ashtanga Sangrah. They are being compiled from there only. When we are studying the origin of Ayurveda, we should learn that Lord Dhanvantri is considered as the god of Ayurveda. We are worshipping Dhanvantri. In Indian culture, Deepavali or Diwali is a very, very renowned festival. Everybody knows about Diwali, the festival of fire. We use most crackers. We worship the Lord Lakshmi. But before that, we worship the Lord Dhanvantri. People think Lord Dhanvantri is about worshipping the money, the Lord of money, so that he will give us more money, wealth. But actually Dhanvantri is the god of health, and people in Ayurveda or people in India, they all consider, or now these days everybody considers health as a wealth. So if we are healthy, if we are following the uh, instructions by Lord Dhanvantari, we will definitely be very healthy. If we are be very wealthy as well, if we are very healthy. So Dhanvantari is actually the Lord of health. He is the God of Ayurveda. So how he came into the world, there is a very interesting story. In your training, there is a video link about Samudra Manthan or churning of the sea. So in this sea, there was a rock, very big rock, and one snake was there, Vasuki snake. These are the gods. These are the evils, bad people, good people. They were churning the sea with the help of this rock and this snake, because they believed there was nectar beneath the sea. So they thought that it will come up when they will churn the sea. So when they were churning the sea, many things appeared from the sea. And first of all appeared the poison that Lord uh, this Shiva drank it, and he just took all the poison by himself. He saved the world, and then came the Lord Dhanvantri with the knowledge of Ayurveda in one hand and the nectar in the other hand. So he, by many tricks, he managed not to give the nectar to the bad people. He managed to give it to the gods, and they were immortal. This is the story. Basically, this is to explain how Ayurveda came into the world. So why Dhanvantri is considered as the god of Ayurveda, because he came to the world with the knowledge of Ayurveda. So next topic is, again we will discuss about it. Be interactive. What do you think about it? What why Ayurveda is unique? You know there are many medical science, many type of pathies which are in the globe. There people are practicing allopathy, people are practicing homeopathy, some people are following Ayurveda, other people are following naturopathy, then pranic healing, Reiki, and Thai medicine, Tibetan medicine, traditional Chinese medicine, acupuncture, acupressure, and the list is going on. So, what do you think, or if you have any insight, why do you consider Ayurveda is unique? If you have any experience, if you have any knowledge about Ayurveda, why, or why do you like to learn Ayurveda? We can ask in this way also. Why you are interested to learn Ayurveda? Why do you feel Ayurveda is um, a better science, or better, it has a better knowledge of understanding of human health? What is your view? You can write down, you can speak in the class. So why Ayurveda is unique? What is found in Ayurveda which is not missing in the Western science or other medical science? If anybody can share. Because Ayurveda works on the cause of the disease and does not solely focus on the curing of the symptoms, right? So it is not a medical science which is trying to alleviate the symptoms. It is trying to work on the root cause. One of the best reason why people turn to Ayurveda. Ayurveda is based on pure nature. It is holistic. It is natural science. We are not using any artificial things. We are not using any chemicals in Ayurveda. That is one other reason why people are using, or they are attracted towards Ayurveda. Ayurveda is sensitive to the context of each person. It is also holistic. Yes, Ayurveda. You mean to say, Zarat mean to say, Ayurveda is individualized, or there is customization in Ayurveda. Ayurveda is different for different person. If two people or three people are having diabetes, it's not that we will give the same medicine to all three people. It will be customized as per their nature, as per their symptoms, as per their cause of disease. And English medicine is effective but unable to address certain health issues like diabetes. Yes, they are mainly we are learning Ayurveda because it is very uh, helpful. It is very effective in lifestyle disorders. To every disease, the pills are not the answer. We have to change our lifestyle. We have to change our diet. And for that, we are turning to Ayurveda also, because Ayurveda is very old science. It has history of 5,000 years, and it is still relevant. If it was not working, if it was not scientific, if it was not effective, it might have perished. People were not be knowing about Ayurveda. But it is working, people are still using, it means they find something good about Ayurveda. Okay. So from my notes, I will let you know it recommends the tailor-made treatment. So customization is one of the very big reason why people turn to Ayurveda, because every person, we take a very long history. What is his nature? What has caused the disease in that person? To some people, stress may be the cause of diabetes. In some other people, irregular eating habits may be the cause of diabetes. And on third person, irregular sedentary lifestyle may be the reason of diabetes. So what root cause we have to address is mainly the beauty of Ayurveda. So it recommends tailor-made treatments. It believes that each individual is a unique identity, and we should offer unique food, unique lifestyle, and treatment to them. That is why we are turning to Ayurveda. Second, everything in Ayurveda is validated by observation, inquiry. So here, unlike the nobody of you discussed about it, unlike the Western science where we are relying more on the investigations. If you go to the doctor, most of the doctors, they will prescribe you the blood test, the x-rays, the ultrasound, the MRI, CT scans, and number of tests. But these days the doctors are also considering the investigations, because we must not miss any serious condition. It is a very good um, tool to help people. But mainly, Ayurveda is validating the people by observing their symptoms, by inquiring about their diet, about their lifestyle, about their family history, about many things, and then directly examining also them. And our methods of examination are slightly different. We are checking the pulse, we are checking the tongue, we are looking at the facial expressions, we are taking the tongue examination, we are doing the urine and stool examination in very different way. Then we are not going to any lab for uh, checking the toxins in the urine or stool or in the body. We have different type of knowledge, and we are using knowledge right from the ancient texts. So these Charak Samhita, Sushruta Samhita, whatever knowledge they have gathered through hundreds or thousands of years of experience, that we are using. Like in people, we get this kind of symptoms. So what treatment you will give to them? So this kind of knowledge we are using in Ayurveda. So it is slightly different from the other medical fields. So Ayurveda believes in five element theory. It also means that Ayurveda is holistic. Five elements are present everywhere. They are omnipresent. So this space, air, fire, earth, and water and earth, they all are present in every country, in every state, in every human being, in every food kind of food. Everything is made up of five elements, and we consider our materialistic things made up of five elements. So that is why we can use the earth rich food in people who have earth deficiency. We can use the fire rich food in people who have fire deficiency. Likewise, we are using these things. So this concept is very unique to Ayurveda. Ayurveda understands that there are energetic forces that influence nature and human beings. These forces are called three doshas: Vata, Pitta, and Kapha. These five elements and three doshas, Vata, Pitta, Kapha, we will study in the next chapters. So this is the uniqueness of Ayurveda, that they are considering three doshas or Vata, Pitta, Kapha as the energetic force. Because Ayurveda believes a strong connection between the mind and body, a huge amount of information is available regarding each. So Ayurveda is a holistic science. We consider the mind and body as whole. We are giving equal importance to the mind or the stress, and we are trying to balance both through our lifestyle recommendations, through our diet. They are few of the reasons why we consider Ayurveda as superior to other fields. Other fields, they are not inferior, but they have other relevance. Like in emergency, you will not go to a person who you will not wait to change his or her lifestyle. In case of emergency, you will go for directly for allopathic surgery or for other interventions, right? So, but every science has some benefits over the other. So, what is the aim of Ayurveda? Why Ayurveda was written? Why Ayurveda was presented to the world? So there is in Sanskrit quotation, प्रयोजनं च अस्य आतुर स्वस्थस्य स्वास्थ्य रक्षणम आतुरस्य विकार प्रशमन. It is in Sanskrit language, but it means स्वस्थस्य स्वास्थ्य रक्षणम, the maintaining the health of a healthy person. If you are healthy and you want to maintain your health, you should follow Ayurveda. That is the main aim of Ayurveda. It is a preventive science. So it was the first preventive science in the world. So Ayurveda talked about prevention so many years back. This Sanskrit quotation was written so many years back when nobody was talking about preventive health. These days, World Health Organization is also considering prevention as the better than curing the disease, but Ayurveda has been doing it for very long time. And second aim is managing the disease of diseased person. If somebody, because of faulty lifestyle, because of some injury, because of some other means gets sick, we should be able to treat that person also. That is the curative part of the Ayurveda. So how we are preventing the disease in Ayurveda, or how we can prevent the disease? There is one more comment, like physicians in the West don't give much information on why the imbalance occur, right? Because most many diseases, nothing is clear. They are labeled as idiopathic because no reason is known. Like most of the autoimmune problems, no reason is known for them, and many other conditions. Nobody knows if there is no family history in the person's family. Still, he is having these problems or other issues. So nobody has answer to that. Ayurveda, on the Ayurveda uh, level, you can diagnose a person's prakriti. You can consider his lifestyle. You can have some answers about it. But many other science who are considering only investigations part to diagnose, they don't find any answer to the cause of the disease. So I was asking, what are the ways one can work as prevent the disease? So Ayurveda recommends many ways. There are many methods which are there to prevent the disease. Can you name some of them? How you think one can prevent the disease? How we can remain healthy? If we are healthy, how we can remain healthy? What should we do? These aspects have also been mentioned in Ayurveda. So one of the things is the food. We have food for different prakritis, different kind of people. Food is one of the component. By understanding our relationship of our body with the changing surroundings, yes, food is one of the component. Then our environment. So Ayurveda is recommending the daily routine, ideal daily routine, and the seasonal routine as well. So in which season you should avoid certain kind of things, certain kind of activities. So these seasonal routine, daily routine, they are part of preventive medicine. Ayurveda is giving more stress on the sleep, on the rest, yes, on exercise as well, dincharya, yes, and eating accordingly, yes. And prakriti is a very unique concept. We all have different prakriti, different nature. Some people are more vata, some people are more pitta, some more kapha. We can design the lifestyle, we can design the food for them, right? Other things like marma therapy, there are special points in the body that we can use to keep our energy uh, circulating in the body correctly. Rasayana concept is there, like there some we are doing the rejuvenation. There are some methods we are using for rejuvenation. detoxification. Some therapies are there, like different kind of massages, different kind of methods of rejuvenating the body. We are having concept of detoxification. If there are toxins, so they can also cause the disease, and if we are doing detoxification at regular time, we can prevent a lot of health problems. Then we have many superfoods also, like people are using ashwagandha, people are using aloe vera, people are using moringa, people are using noni. They are the superfoods. They are very having very good nutritional value, but these are not suitable to everybody. Everything is not suitable to everybody, but there are some of the methods how we are working as a preventive science. Right. And secondly, curative for the curative purpose, we are using the first at the if the things are very mild, this is very mild. We are using the home remedies. We can ask somebody to use some spice and change the lifestyles. If the symptoms are moderate, we can use the herbal drugs. If they are very severe, if the person is critical, we can use the herbo mineral preparations. We can use some minerals as well for that. We can take use of the panchakarma treatments, some different kind of abhyang massage, shirodhara, potli massage, and enemas and gut detoxification, vomiting procedure. These are also available. Marma therapy is also available. We can use the marma points in the body for curing this. And sometimes the therapy, other therapies like Agni Karma, burning at some point to arrest the bleeding, leech therapy to detoxify the bad blood, and these kind of methods are available if the condition is moderate or having moderate severe symptoms. So both preventive and curative aspects are there in the Ayurveda. This is the aim of Ayurveda. There are two aims of Ayurveda. Prevention is the first aim, and second aim is the cure. As the time passed, Ayurveda developed very systematically into the 8 branches. These days, when you enter an very big hospital, you will find departments like pediatrics, you will find gynecologist, and doctor of ENT, ear, nose, and throat, doctor of ophthalmology, eyes, orthopedician, plastic surgeons, nephrologist, urologist, hematologist. So many specialities are there. In Ayurveda, there are 8 branches, 8 divisions. They are in some way related to the same modern science, but some way they are different also. So we will discuss about these 8 branches. They are very interesting. The Sanskrit names will be very not very familiar to you. So you can, if you study this part of the chapter twice or thrice, then you will be familiar with the terms like branches like internal medicine, the physicians who are dealing with the general problems like fever or diabetes or diarrhea, weakness, any part. They are the part of internal medicine. This it is known as Kaya Chikitsa. Kaya Chikitsa. People of the Kaya Chikitsa, they are dealing with the common diseases and their management. So internal medicine. This is one branch of Ayurveda. Shalakya Tantra. It is the branch dealing with the problems of head and neck. So head and neck covers lot of branches of the modern science, like ophthalmology also is under this branch. Otolaryngology or ear and throat disease, nose disease doctors, they also come under this branch. Dentistry also comes under this branch. So Shalakya Tantra is having very wide range of problems. So every disease of any disease of head and neck, they will go to the specialist of Shalakya Tantra. Like people having the headaches, people having the eye problem, people having the nose issues, ear problems, dental problems, throat problem, they will go to the Shalakya Tantra branch. Then Shalya Tantra. Shalya Tantra is the surgery. So if there is some injury, if there is some bleeding, if there is some fracture, then people go to the surgeons in Ayurveda. They go to the Shalya Tantra. Then Agadha Tantra. Agadha Tantra is the toxicology. If somebody has taken some poison, there are special doctors trained to manage the poisons. Poisons may be animal origin poisons like bites, dog bite, scorpio bite, any other bite, and toxins from the plant like somebody takes the opium or the cannabis or any other toxic plant. So they can manage the toxins in these people. People trained in the Agat Tantra. Then Bhuta Vidya. Bhuta Vidya is the Indian spirituality as well as psychiatry. So they are also using some counseling. They are doing some, they are using some medicines also, herbal medicines like commonly they are using the ashwagandha, the brahmi, the tagra, these kind jatamansi, valerians. They are the very commonly used medicines is this branch, but they are basically dealing with the psychological issues or psychiatric issues. Then a branch known as the Kumar Bhritya. It covers the pediatrics as well as the obstetrician as gynecology, also gynecology, obstetrics and pediatrics. The doctors dealing with the female reproductive problems, with the pregnant ladies and with the children. They all come under the Kumar Bhritya. And the last two branches are very interesting, very popular in Ayurveda. One is the Rasayana. Rasayana branch is the science of rejuvenation or anti-aging, most popular branch of Ayurveda. Many people wish to reverse their age. They want to look young. They want to have rejuvenation or detoxifying their body. So this is the Rasayana branch. And the last is the science of fertility or people having reproductive problems, male as well as female, they come under this branch, the Vajikarana. They refer to people specialized in Vajikaran Chikitsa or Vajikaran science. So they are the eight branches: the Kaya Chikitsa, internal medicine, Shalakya Tantra, head and neck problems, Shalya Tantra surgery, Agat Tantra toxicology, Bhut Vidya psychiatry, Kumar Bhritya gynae obs and pediatrics, Rasayana the rejuvenation, and Vajikaran the science of fertility. They are the eight branches in, and we call them the Ashtanga Ayurveda. Ashtang. I think I missed the word in the notes. I'm writing in the chat. So eight branches in Sanskrit we call them Ashtanga Ayurveda. Ashtanga Ayurveda. So here Asht means eight and Ang means divisions. So eight divisions of Ayurveda. Ashtanga Ayurveda. So we have few minutes, so we will study about each of them. If you find it interesting, we will interact also about these branches. So Kaya Chikitsa, the internal medicine, the general medicine, the common problems and their healing, they are considered as the one branch in under the Kaya Chikitsa, internal medicine. Kaya means the Agni. Kaya means the body also. We call Kaya or Dehe or body. They are Sanskrit names for body, but we mean Kai as Agni also. Agni means the digestive fire. We have digestive fire. We feel appetite, and Ayurveda considers if we are having very good appetite, we are healthy. If we don't have good appetite, we may fall sick very easily. So people who are trained in this branch of science, they take very serious care of that our Agni is perfect. If we are having very good digestive fire, and if they treat the Agni or they treat the body as a whole to manage the diseases. So general treatment, and it encompasses other branches also. Other branch doctors can also refer to these people, the cases who are they are having general disease. So Ayurveda considers the Agni Mandya or deranged Agni as the root cause of all diseases. So diseases like fever, anemia, diarrhea, and diabetes, blood pressure, everything. The whole general medicine has been covered in this particular branch. This is the internal medicine. Very simple. And next one is the Bal Roga, the diseases of children, or Kumar Bhritya. Kumar is also children, and Bhritya means how we bring up them. So Kumar Bhritya or Bal Roga, they are related to pediatrics and gynae and obstetrics as well. So this branch deals with the disease of children. So because children have special needs, they have special doses. Their medicine should also be very special, like palatable. They should be able to. Children should be able to take the medicine. So this new branch was developed. So Ayurveda gives more emphasis on the breast milk. Breastfeeding has been always been recommended by Ayurveda, and breast milk should be proper in quality also. No other medical science till now, as far as my knowledge goes, there are no investigations for breast milk. Nobody goes for testing by breast milk. There are no parameters for that. But Ayurveda has classified the problems in breast milk as there are. He classified there are 8 type of issues in the breast milk and what they can cause in the children and how to treat them. Everything has been mentioned in the this special branch of Bal Roga Kumar Bhritya. There are special herbs that can deal with the problems in the breast milk. So this branch is with the children and the pregnant ladies, mother and children. Third branch, Graha Roga or Bhoot Vidya is psychiatry. So these branch deals with the psychological issues, psychiatric issues. Not very popular, but yes, this branch require research. But yes, to some extent, we are managing stress in Ayurveda by these herbs, simple herbs, by some therapies like head massage, shirodhara. We are using these days. We are managing these kind of problems in Ayurveda. Then this branch is Shalakya Tantra or the treatment of head and neck. It covers the eyes, ears, nose, throat, dentistry also. So it is also known as Urdhvang Rog Chikitsa. So anything above the shoulder. So above shoulder is our neck and head. Any problem above our shoulder is the Urdhvang Chikitsa or comes under the domain of Shalakya Tantra. So the problems in the eyes, nose, throat, they are being dealt in this branch. Then the Shalya Tantra, it is very interesting. People feel that there is no surgery in Ayurveda, but yes, surgery is there. And I told Sushruta has been known as the father of modern plastic surgery because he performed the first nose reconstruction rhinoplasty in the world. So there has been decline in Ayurveda surgery over the time under the influence of Buddha, under the influence of Mughals. They destroyed the knowledge, Indian knowledge about surgery. So Sharitantra means Shalya means the foreign body, Tantra means the science. The science dealing with how to deal with any foreign body. Foreign body means any weapon, any bullet, any sword, anything that can cause your body injury. It can be managed under this science, Shalya Tantra. So there were so many wars going on in the old times. So there were so many traumas, bleeding, fractures. So this was the branch which deals with the surgery in Ayurveda. And this there is I have mentioned one thing, Kshar Sutra. Kshar is your now it is your topic of research. I will not explain anything about Kshar Sutra. You can see in the notes a different kind of surgery known as Kshar Sutra is most useful in fistula in ano. So you should uh, after the class, you should type this word in Google. You should learn about it. You should study about Kshar Sutra and also fistula in ano. What are these problems? How Ayurveda is using the Kshar Sutra or surgical technique in managing this problem. And even World Health Organization (WHO) has recommended this technique as a very superior technique in managing the fistula problem. Many people who had conventional surgery for fistula in ano. And when it fails, people come to Ayurveda for Shar Sutra. So you should study. You should find the meaning of Shar Sutra, what is and what is fistula in ano. Then in the next class we will discuss. Okay, this is the homework for you, all of you who are doing this chapter for the first time. Sixth branch is the Agat Tantra, toxicology. This branch deals with the poisons, plant poison, animal poison. So their treatment is mentioned in Ayurveda. Some herbs are mentioned, some procedures are mentioned to manage these problems. Then the seventh and eighth branch, the Jara Chikitsa and Vajikaran. Jara Chikitsa is the Rasayana Chikitsa, or Jara is known as the old age. So the treatment of old age people, or it is known as geriatrics. Geriatrics is a very new branch in Western science, but Ayurveda has been dealing with Jara Chikitsa so many years back. The problems that old age people feel and how to manage them is the one of the branch of Ayurveda. Rasayana means rejuvenation. How to keep young, how to have very good energy levels is a branch of Ayurveda. Okay. So how we are achieving? We are basically working for increasing the quality of life. These days, people with cancers, when they undergo the chemotherapy, when they undergo radiotherapy, so we have to maintain a quality of life for those people who are terminally ill. So by Ayurveda, we can achieve that by giving some herbs, by giving some dietary instructions, by giving them some therapies like massages, different kind of techniques. We can maintain their quality of life. This is the branch of Ayurveda that deals with it. And the last branch is the Vajikaran. Vaji is the name for horse. So people who have wish to have the power like horse, but this is more linked with the sexual energy rather than the whole body energy. And this branch is dealing with the sexual problems of males and females, and there are special medicines which act like aphrodisiac or sexual tonics, and also they are dealing with the problems of infertility and managing it with some herbs, some detoxification techniques, and other techniques. These branches are very popular in Ayurveda. Okay. So, if there are any questions about the eight branches, I hope there will be many. Okay, Divakarji has written not audible. Was I audible to rest of the students? Okay, okay, thank you. Okay. So, any questions? Any questions about the branches of Ayurveda? Eight branches. If you have any doubts, you can ask about Kaya Chikitsa, about pediatrics, about the managing toxicology, about ENT, about the sexual medicine, about the rejuvenation medicine. There are eight branches of Ayurveda. Or if they are clear, then we will proceed to the next topic. In Ayurveda, we believe in mind, body, and soul concept. Ayurveda is a holistic science, so we not only deal with the physical body, but with the mind and psychology also. So this is the description about how our physical body is linked with the mind also, like our respiration, breathing, our circulation, our digestion, and elimination also. They are so much linked with our mind. If we are into stress, our respiration is not normal. We breathe very fast, or in some conditions, narcolepsy or in depressions, we breathe very slow. It becomes very low as well, or it is not normal. Circulation is also affected by, if we are angry, if we are agitated, if we are stressed, we have different circulation. Digestion is also very much hampered when we are into stress. Our mind is not healthy, and elimination is very much disturbed. So these days, irritable bowel syndrome is a very common problem people are suffering. So it is more linked with the body and mind, and we call them psychosomatic diseases. So this is about the mind body integration, and soul I will also discuss when we move further. So we can think our mind as a computer and the senses as the data which gets entered into the computer. So our sense organs, our eyes, nose, ear, tongue, and the skin, they gather the data from the environment and they feed into the computer. The mind is working as a computer, then it will control the body. Next, smell and taste, they are very much dependent on the mind. So our digestive juices, enzymes, they get secreted when you have something favorite. If something is very favorite to recipe, you will have very good digestive enzymes, and Otherwise, if you don't like a recipe and that is offered to you, you will, if you are feeling hungry, even then you will lose your hunger. So this is about how our mind is linked with the body, and digestion and respiration, they are affecting by mind. A soul, Ayurveda is a holistic science, it's a philosophical science. An Indian philosophy, we believe in reincarnation. There are soul, the ultimate soul, and the human soul. The ultimate soul is the paramatma, paramatma, or the ultimate soul. And jivatma, or the human soul, is the Atma. So we are never dead. When we die, our physical body dies, but our soul is going to the Paramatma. Then we take new birth. This is the Indian philosophy, and many other part of the world, they are also believing on these this theory of reincarnation. So So Atma is perceived through its action through the media of body and mind and senses. So Atma is ultimate. Sometimes body or mind or sense organs are doing very good deeds. They are very harmonized. But if our Atma is not giving them the approval, then we may also get sick. So that is why Ayurveda believes in spirituality also. It believes to follow religion also. Ayurveda is recommending worship also. Everything Ayurveda is doing. Indian philosophy rather, not Ayurveda. So Ayurveda also being a science derived from the Indian philosophy, they're also believing on this. So we have a physical body and a subtle body. Subtle body is our soul. So it carries all the previous life impressions that enters into the elemental body, this physical body. How we can explain this? Like the diseases which have been termed idiopathic, or they don't have any reason in Ayurveda, in the medical science, or the diseases which have been labeled as hereditary or genetic, we may consider those diseases as the part of his Atma influence. If our Atma is there of previous birth, deeds are there, so we are suffering from those problems. We don't have any solution. This is one of the philosophy we can think about it. And so in the Atma, it is the central part in the it is in the center of the body, and like it is like a source of light. It is like a lamp, and as we blow the lamp, there are some layers around the lamp. There are five layers, so we consider this as panchkosh, or five sheets around the soul. If we consider this self or soul as a lamp, and there is a dark room, so when the light is switched on, so you will find five layers around the lamp. So these five layers are, they are imaginary, you cannot see them, but you can feel them when you are doing meditation. So it is a part of yoga, and yoga also, people who are following the yoga and doing meditation, they are also taught about the panchakosha and their importance. So outermost is the food sheath, or annamaya kosha. Like if you start doing meditation, if you close your eyes, what comes to your knowledge is the physical body. You will be able to feel, you have hands, legs, middle body, head, neck, everything you can feel, because your awareness is at the level of physical body. So that is why we call it the annamaya kosh, or food sheath. If your body is dependent upon the food only, so your awareness is only up to the physical aspects of the body. And secondly, if you start doing meditation for more deeply, for more long duration, then you realize when you close your eyes that you have some movements also in there. There are some vibrations happening in the body as well. You can feel that you are breathing, and when you breathe in, it is cooling. When you breathe out to nose, you feel some warm sensation on the upper lips. So these feelings give you indication that you are not a still body, you are having some prana also, you are having some vitality also, some vibrations also in the body. So your awareness goes to some a deeper level, up to the pranamaya kosha. third, if you still keep on doing meditation, your awareness is going very deep, then you start understanding your mind. What are your likes? What are your dislikes? What are your doubts? What are your enjoyment? The emotions you try to explore. So this layer, when somebody goes, he is aware to the likes or dislikes. And still deep, if you are doing meditation, your awareness will go to the Vigyanmay Kosh. Vigyanmay Kosh is the intellectual sheath. Here you will be able to judge. You make you will be, it is helpful in your decision making process and judgments to the mind. So you will realize what is good for you in long term. You may like one thing today, but it is not good for you in longer run. So you will start disapproving that. You will not follow that. So this awareness comes when you are meditating, and your awareness is going very deep up to the Vigyanmay Kosha. So it generates the consciousness, it generates the intelligence. And still deep, when you are touching the Anandamay Kosh or the bliss sheath, it is the deepest layer of body around the soul, and it is the sheath of sleep and bliss. So when we enter the sleep, we are enjoying, we don't have any stress, we don't know what is happening near us or around us, what is happening. So in this sheath, if we are having awareness, we are always enjoying the life, we are always peaceful. So this is the consideration, this is the ultimate goal of a human person, to achieve this Anandamay Kosh, bliss sheath. So this is about Ayurveda and mind body integration and soul and 8 branches. If you have any questions, we have very little time left because we have next class also. But feel free to ask, if as much as possible I will try to answer. As per Ayurveda, how many times a person can take food? Food, normal person should take dvikalik or twice a day. But there are recommendations. Some should, people should take thrice or frequently also. Some people should take only once a day also. As per for the normal person, twice a day. How many times person can take food in day? 2 times or 3 times? What time it is better to consume food? Whenever you feel appetite, that is the best time. As per Avida, when you have good agni, when you have appetite, you should consume food, and you should consume earlier. Then it becomes dark. So in the evening, take precautions to, before sunset you should consume your dinner. But twice a day is recommended for a healthy person who is having good appetite. Once a day for people who have very low appetite or who are sick, and very frequently for those people who are vata in nature, who have irregular appetite. Whenever they feel, they can take twice or thrice or 4 times as per their appetite. Any other question? So this topic is more dealt in the training of this diet and nutrition. There we discussed about this fasting and the diet rules of dietetics. They are more dealt in this topic. Food 8 a.m., 1 p.m., 8 p.m. No, this is not as per Ayurveda. 8 a.m., 1 p.m. may be okay, but night time is Ayurveda does not recommend. For a healthy person, Ayurveda recommending only twice a day meal. Any other question linked to today's topic? You can feel free to ask. Otherwise, we will. Or if you don't remember anything to ask this time, you can make a note. You can search other sources also. You can Google about other things also, and you can. I will try to share the link for downloading the Charak and Social Samhita also. That also you can go through. If you have any question, you can feel free to ask. You can WhatsApp us, or you can, if you join the courses, you can ask in next classes also. We are always open for the discussions. Okay, that is all for today's class or topic on introduction to Ayurveda. We will be discussing about next. We will be discussing about five elements, how they affect our body, and what are the recipes, what are the food that are rich in these five elements, how we can use them. And after that we will discussing the vata, pitta, and kapha energies in the body, their practice, their types, how they get imbalanced, how we can balance them. So this way we will proceed to the course of fundamentals as well as diet and nutrition. Okay, thank you for attending. See you all again. Bye. Take care. Have a nice time.